Hi, Dr. Bree here of AskTheDentist.com. So this week's question comes from a reader, and it's a really good question. Sometimes my readers ask questions that I wish I had asked for the sake of the blog and the YouTube channel. And that is, does a crown, a porcelain crown, a gold crown, does it require special care? And the answer is yes. And I think sometimes dentists don't convey this message enough, and that is that we use the word permanent crown and we bill that as a permanent crown, and everyone thinks it's permanent and that it's done. A crown needs maintenance. So a few things. See your dentist often, every 6 months, because we can see if the crown is being maintained well. And of course, then it's flossing and brushing. But let me expand on that a little bit. So where the tooth and the crown meet is called the margin, and that margin is never completely fully closed. A really well-made crown will have like a 5 or 10 micron discrepancy, which is really good, but that's sealed with cement. Eventually, that cement will break down. It could take 10 to 15 years for a porcelain crown, and for a gold crown, maybe 20 to 60 years. Gold lasts a little bit longer because it's easier to make it fit with tighter tolerances than porcelain, although that's debatable. But porcelain can break, and it can fracture under hard stresses, and gold will never break, so gold typically lasts longer. But anyway, where the two meet is the weak spot, and that sometimes can be below the gum line or above the gum line. But in any case, you can floss it if it's below the gum line and floss it and brush it above the gum line. That area has to be kept free of plaque, so the plaque won't get into that area, dissolve the glue that keeps that area closed. And if you do that, your crown will last much longer. So that's a great question. A crown does need maintenance. Thanks for listening.